Continuing on with epithelial cells, we're going to look at glands. Now, these epithelial tissues can dip down below the surface and create these glands. There are two types of glands. Here we see exocrine glands, but there are also endocrine glands. Endo means inside, exo means outside. And one thing about exocrine glands is they have ducts. D-U-C-T-S, ducts. So exocrine glands have ducts. Endocrine glands don't have ducts. And here's how I think about it. You know, when you're sitting in a classroom and maybe it's time for the class to end, you know, what's the first thing that you're thinking of? I know what it is. It's follow the light. Well, what light am I talking about? Oh, I'm talking about the exit light. Okay, because exo or exit, where does that lead to? It leads to outside. So exo means outside. And you pile into the hallway, and to me a hallway is a people duct. You know how you have duct work for like your heating and your air conditioning? That's what kind of channels the air to the different vents. Well, the hallway channels people to the different rooms or to, you know, the exits. So that's how I remember that exocrine glands have ducts. Endocrine glands, think of them more as a sponge. They kind of ooze their secretions out into the interstitial fluid, and from there it's absorbed into the bloodstream where then its product goes throughout the body. So in this case, we're going to be talking about exocrine glands. And this is an example of a single-celled gland or unicellular gland. It's called a goblet cell. Okay, it's a goblet cell. And if I were to draw a little stem on here and a little base, it would look like a water goblet or a wine goblet. Okay, so that's how it gets its name. And you're going to find these in the intestines, in the respiratory passages, because what they make is mucus. They make a lot of mucus, and you're going to find a lot of mucus in the respiratory and digestive systems. Also, this is to note, and this might even be on an exam, what type of tissue typically makes these glands? Well, it's going to be a type of tissue that's called columnar epithelium. And if we trace this out, it would be tall and thin, like a column. And that's the way we call it, columnar epithelium. Don't worry about that too much now, because I am going to mention it again later, but just to help reinforce it. And so looking at the different types of exocrine glands and their secretion types, the first type we have Merocrine, also called Eccrine. And most glands are of this type. And the cells release their products by exocytosis. And an example would be like saliva, digestive enzymes, and sweat. Now, one type of sweat, and that's that watery sweat like you get on your forehead and most of your body, you know, if you're overheated, that type of sweat that they call sensible sweat. And why they call it that, I have no idea. But basically, when you perspire, that watery sweat evaporates and you get this evaporative cooling effect as long as you don't live in a humid area. So this type, again, is through exocytosis, where the product is made, you know, the proteins are made in the rough endoplasmic reticulum. It's sent to the Golgi, where again it's modified, it's packaged, it's shipped out through these little secretory vesicles. They're secretory. I could tell you what they are, but then these secretory vesicles that then fuse with the cell membrane and spit out the product into a duct. And in the case of saliva, it would be literally spitting out that product into a duct. But anyway, I digress. So that would be the Merocrine glands. The other type is the apocrine glands. Now, I call them apocrine glands, apocrine glands. The next type would be apocrine glands. Now, I call them apocrine glands because this is the smelly sweat. This sweat is going to be thicker, okay? I call it apocrine because if your roll-on rolls off or your right guard's wrong, then you're going to smell like this guy. You're going to smell like an ape, okay? It's really pronounced apocrine gland. But the other reason I call it apocrine is because the apex of the cell gets pinched off and becomes part of the secretion, okay? So it gets pinched off, that part of the cell dies off, and so you can imagine that's one of the reasons why it's going to be thicker. That's another reason why it's probably going to be kind of smelly. Think about anything kind of dead, what's going to affect it? Bacteria. So that's going to impart odor to it. Also, not to mention human pheromones and things like that will also add scent to it. So again, this is the thicker, smelly sweat that you find in the armpits, the groin, and the anal region. Okay. And then we have the holocrine gland. Okay, it's really pronounced holocrine, but I call it holocrine because the whole cell dies and becomes part of the secretion. So that's even going to be thicker. Think about the oil glands. You know, when you get like maybe an oily forehead or what have you, that is going to be much thicker than sweat. So the whole cell dies and ruptures to release their products. So again, the three types are going to be the Merocrine / Ecrine, and that's going to be through exocytosis. The next thing you remember is the ape for apocrine, because the apex pinches off. And again, that's the smelly sweat. Also milk. I did mention that. Think about milk. Milk is a very complex product, and there's a lot of fats and proteins and all of that in milk. And so you can see why, you know, this would probably most likely be the process that would produce milk. Now, when I say most likely the process, because I've read books that say that the process of making milk is from the Merocrine glands. Matter of fact, one semester I had two students with the exact same books, same year, same everything. One book said it was a Merocrine gland, the other one said it was an Apocrine gland. The point is, though, that it's a very complex product, and most likely it's made by both types of glands. Okay, but for our purposes, for any tests, milk, we would say, is apocrine. And then again, the holocrine or holocrine, because the whole cell dies, and that an example would be an oil gland. Now, looking at connective tissue. Connective tissue is the most abundant, most diverse tissue in the entire body. It's going to consist of cells separated by an extracellular matrix. Remember, there's a lot of space in between. Think about the epithelial tissue, where you have cells butted up and fused to one another to create a sheet for covering. The cells are dispersed. It's going to perform a variety of important functions. It's going to do everything from protecting your brain, okay, bone is a type of connective tissue, to fighting infections. Okay, what does that? White blood cells. So your blood is also a type of connective tissue. It's going to hold things together. If it holds your skeletal bones together, we call that a ligament. If it attaches your muscle to your bone, we call that a tendon. So all of those things are types of connective tissues. So the function of connective tissues, it encloses and separates, such as capsules around organs, connects tissues to one another, like I just mentioned a second ago, such as tendons connecting bone to bone, tendons connecting muscle to bone, and ligaments connecting bone to bone, and supporting and moving, such as bones, storing, such as fat, storing energy, such as fat, cushioning and insulating, such as fat. Again, fat's a connective tissue. Transporting, as in blood, and protecting as cells of the immune system. So that's just kind of a review of what I mentioned in the previous slide. And now there's going to be specialized cells that produce the extracellular matrix. And the suffixes we're going to see are blasts, cytes, and clasts. Now, blasts make things. They create the matrix. Okay? So, if it makes bone, what would we call it? Well, the prefix for bone is osteo. So a cell that would make bone would be called an osteoblast. What if it's a cell that makes cartilage? Well, chondro is the name we use for cartilage, so chondroblast. What if it makes fibers? I'll let you guess. Okay, if you said fibroblast, you're correct. So again, blasts make things. I think of if you asked him, oh, what do you do? I see your name is osteoblast. Well, I make bone. Oh, wow, that's interesting. Do you like your job? Are you kidding? I have a blast making bone. Okay, so blasts have a blast making things. Okay, so that's what you want to remember. Cytes are cells, and what they are mature blasts, and they help maintain the matrix. So an osteoblast would make the bone. An osteocyte is a mature osteoblast that now just hangs out. It doesn't make bone, but it helps to maintain the bone. And then clasts break it down. Okay, so it breaks the matrix down for remodeling. So an osteoclast would tear bone down, while an osteoblast would build bone up. Okay. All right, other connective tissue cells. We have adipose cells or fat cells. We have what are called mast cells that contain heparin and histamine. We find these cells in tissue, and they're derived from the blood. Okay, and well, what's heparin? What's histamine? Have you ever taken an antihistamine before? Why did you take an antihistamine? Right, you might have had allergies. And if you had an allergy, because there's a lot of histamine in your system, what did your eyes do? They became runny. What did your nose do? It ran. So your eyes watered, your nose ran, you might have gotten puffy. So basically, histamines make you leaky. And mast cells are in the tissue so that if you get a cut, it's going to make those capillaries leaky so that the other white blood cells can get out of the bloodstream and into the tissue. What's heparin? Heparin's a blood thinner. So the mast cell also releases a little blood thinner to keep you from clotting right away. Well, why would you want to not clot right away? You're bleeding, right? Well, you don't want to clot immediately because, again, we want those blood cells, those white blood cells, to be able to stream into the area, not get caught up in a clot, and start killing off bacteria and eating away some of the dead cells. Okay, and so that's what heparin would do. Now, white blood cells, again, are a connective tissue cell, and they respond to injury or infection. Macrophages are a type of white blood cell that phagocytizes, which means it eats things, so that helps to provide protection. And then we also have stem cells. Again, stem cells are undifferentiated cells that can turn into whatever. Like, for instance, we have what's called a pluripotent stem cell in the bone marrow. And this pluripotent stem cell can turn into all the different types of red and white blood cells. Okay, so it's undifferentiated, but once it differentiates itself and specializes, it'll become one of those other types of cells. And then the extracellular matrix. The components are protein fibers, and collagen is the most common protein in the body. It's a very tough substance. A fiber of collagen and a fiber of steel, from what I understand, collagen is as tough, if not tougher, than a strand of steel the same diameter. So it gives our skin and bones and teeth and just about everything, it gives it strength. Matter of fact, disorder, scurvy, you have a deficiency in collagen. And what do you get with that? You get sores, cuts don't heal, wounds don't heal. You start chipping and breaking teeth. It's easy to break bones. It's easy to bruise. So all that because of deficiency in collagen. And then we have reticular fibers, and these fill spaces between tissues and organs. Think of a very coarse, rough sponge. Okay, very coarse sponge. And I'll show you an example of that later on, but that's what I think of three-dimensionally with reticular tissue. And within that coarse sponge is where the cells are going to be, and the cytoplasm and all of that. So it's just going to give it some structure, some support. And then we have elastic fibers, and these, of course, return to its original shape after distension or compression. So in other words, we stretch it out as long as we don't go past what we call physiological restrictions or physiological norms. If we go past that, of course, we can tear it or overstretch it, just like anything elastic. But if we stay within those physiological ranges, then it's going to stretch and it's going to return back to its normal shape. And then the ground substance is going to be the shapeless background. And again, that shapeless background can be liquid. It could be kind of almost like a gel. It can be solid, like bone. And it can also, like I said, be fluid in the case of blood. Now, connective tissue categories. We have embryonic or mesenchymal tissue, and we have adult connective tissue. Now, that embryonic or mesenchyme tissue is going to have a lot of those undifferentiated cells. It doesn't look like a whole lot when you look at it under the microscope, okay? But the adult connective tissue has a lot more structure to it. And we have the first two, the loose and the loose and dense connective tissues. We call these the connective tissue propers, okay? And then we have connective tissues with special properties, and that would be adipose tissue would fall under that. We have three different types of cartilage. We have bone and we have blood. So when you look at these tissues under the microscope, that's what you're going to say. Well, first of all, you look at it, and does it have a free surface, and does it have a basement membrane? If it does, then it's going to be one of the epithelial tissues. And remember, what do we learn, or how do we classify epithelial tissues? Well, we're going to look to see if that epithelial tissue is is a single layer, in which case we would say it's simple, or is it multiple layers, 2 or more cells stacked on each other, and we would say that that's stratified. And then we look at the shape. If it's flat, we say it's squamous. If it's taller than it is wide, we say that it's columnar. If it's cube-shaped, we say it's cuboidal. And if we're going to name it, we also have the weird one that looks like it's stratified, but it's really not. So we say it's falsely stratified or pseudo-stratified. Okay, so that's how we would name epithelial tissues, but maybe it doesn't fit that category. So then we're left to, is it muscle? Nah, it doesn't look like the 3 types of muscles. Is it nervous tissue? No. So then it must fall under connective tissue. And then if we decide it's a connective tissue, we decide, is it loose connective tissue? Is it dense connective tissue? Now, the other thing about dense connective tissue is we have to think, is it regular or irregular? Okay, and we'll be seeing examples of these things later. If it doesn't fall under these 2, then it's probably going to fall under one of these. So let's look at loose connective tissue. Another name for loose connective tissue is areolar tissue or areolar connective tissue. It's going to be loose packing material of most organs and tissues, and it attaches skin to the underlying tissues. It contains collagen, reticular fibers, elastic fibers, and a variety of cells. If you've ever made chicken before, and if you peeled off the skin of a chicken, sometimes there's this clear stuff just kind of covering the chicken after you peel the skin away, and then you kind of peel that off. That's going to be the loose connective tissue. If we took a piece of that, put it on a microscope slide, and stained it, this is what it's going to look like. We're going to have these thick pink fibers. That's going to be collagen. Okay, now it stains that color. Anything we look at under the microscope typically is clear. So if we stain it, though, they stain pink with this type of stain. Okay, so remember that for practical exams. Typically, collagen will stain this pink color. So these are the collagen fibers. Now I think of these black fibers as rubber bands. So they're going to be the elastic fibers. Now we see a bunch of cells, and it says here it's a nucleus. Well, duh, yeah, it's a nucleus in a cell. But what kind of cell is it? Well, it's a little hard to tell in this picture. But the types of cells that we can have in here are fibroblasts. We can have, what else? Mast cells. Remember those? We can have some macrophages in there. So those are some of the cells that we would find. Now, on an exam, since we really can't tell what's what, it might give you a little more of a hint. So it might say, oh, I don't know, name this cell that makes fibers. Okay, so name the cell that makes fibers. We just talked about that. What makes things? Blasts. So what would make fibers? Fibroblasts. Okay. And then again, the dense connective tissue, we can have dense regular connective tissue, and that has abundant collagen fibers. We're going to find that in tendons, again, which connect muscle to bones, and ligaments, which connect bone to bone. And let me just show you an example of that. So here is our dense regular connective tissue, or dense regular collagenous connective tissue, if you want to get a little more specific. See how the waves in this case are very uniform. They're very regular. Now, honestly, most slides that I look at of tendons and ligaments, they tend to be very straight. In this particular slide, it's a little wavy, a lot of times they're straight. Okay. And then what else do we have? We have dense, regular, elastic connective tissue. And that would be like the ligaments in your vocal folds, your vocal cords. Then we have dense, irregular connective tissue. And an example would be like scars. Then we can also have dense, irregular, collagenous connective tissue, and that forms the skin's dermis. So let's take a look at that. So here's an example of skin. The epidermis is going to be made up of stratified squamous epithelium. So that's an epithelial layer. Underneath that is going to be the connective tissue layer. And if you take a close look at that, look at it, it's just all over the place. It's pink. So this is our dense, irregular, collagenous connective tissue. Okay. And then we have our dense, irregular, elastic connective tissue. And we're going to see that in the walls of elastic arteries. And one of the main elastic arteries are going to be the aorta, because as your left ventricle contracts, it squirts blood up into the aorta, and that aorta is going to have a lot of pressure in it, so it's going to kind of balloon out a bit. Because of its elastic nature, there's a lot of elasticity in there to take that extra pressure. And then when it rebounds and recoils, that helps to propel that blood, a little more proficiently throughout the body. But if we take a look at this, doesn't this look like, if you've ever had like gym shorts or phys ed shorts, or maybe the waistband on an old pair of underwear or something, see how it looks like the elastic band. It's all wavy. And maybe we went to, I don't know, TJ Maxx or something like that to buy it. So it wasn't first quality, it was irregular. Okay? So this would be our dense, irregular, elastic connective tissue. And again, these are all wavy because when you pull on it, these straighten out and it allows it to expand. And then when you take the pressure off, it recoils back down and looks all wavy again. But see, it's not very uniform. So we say that it's dense, irregular, elastic connective tissue. And then connective tissues with special properties. Again, we have adipose tissue, which consists of adipose sites. And adipose tissue comes in two flavors. We have yellow or white adipose tissue and brown adipose tissue. The yellow or white is most abundant. It's white at birth and yellows with age. And this is what's going to store fat and store energy and things like that, which is kind of interesting because when you think about it, that stored up fat is energy. So I must be incredibly energetic. I kind of wish I felt that way though. Anyway, got to get rid of some of that energy, especially around the midsection here. Anyway, the brown fat is found only in specific areas of the body, such as your armpits, neck, and around your kidneys. This is a more metabolically active adipose tissue. It's more for protecting, and again, because it's more metabolically active, it's going to give off some heat. And again, it's going to help in those areas to warm those areas up. Okay. And then reticular tissue forms a framework of lymphatic tissue. It's characterized by a network of fibers and cells. So here's an example of adipose tissue. Look at this. It looks like bubble wrap. So if you're looking at a tissue under a microscope and it looks like bubble wrap, if you're looking for adipose tissue, you're at the right part of the slide. If you're looking for pseudostratified ciliated columnar epithelium, you've got the right slide probably, but you just need to move this to one of the opposite edges of the slide, opposite this adipose tissue. But adipose tissue, remember, it's going to look like bubble wrap. Okay? I wish it was like bubble wrap. You know how you sit there and pop the little bubbles? I'd be sitting here popping those little fat cells. But anyway. And so next we look at reticular tissue. And reticular tissue is going to be found in things such as the bone marrow, lymph nodes, the spleen, Peyer's patches, tonsils. So basically lymphatic tissue is plus bone marrow are the two places where you're going to really find reticular tissue. There's other tissues too that contain reticular fibers, but reticular tissue is where, again, you're going to find that in the lymphatic tissues. And that previous picture I'm not so crazy about, but here's a much better picture. This one's just not stained, like I like, but with a special stain, you can see these reticular fibers so much better. And right here, you can see the reticular fibers. And again, what this reminds me of is a very coarse sponge. Like this sponge, it's called a stippling sponge, but very coarse. And if we took this and we soaked it in some Jell-O, put the Jell-O in the refrigerator, and let it set up, that's kind of what it would look like here. And if we took a nice thin slice out of it, you'd see like these little cut ends and little cut pieces like you see here. And that's what we see here, these little cut ends. But three-dimensionally, this is your reticular tissue. Okay? And why do they call it reticular? Because it forms, see these little diamond shapes? Okay, where I'm pointing with the arrow. These little diamond shapes are a reticulated pattern. It's kind of like this guy here. See how we have these little diamond shapes? This is a reticulated python. Giraffes, some giraffes have a reticular pattern, and they call those reticulated giraffes. So it has a lot to do with the pattern, okay? And we see that pattern in the sponge, and if you kind of look kind of hard and pretend here, we can see that pattern again in this tissue. Cartilage. Cartilage is composed of chondrocytes located in a space called a lacuna. Lacuna means lake. Okay, so like Lake Lacuna. What this kind of reminds me of, have you ever done this with like a melon? You have a scooper and it scoops out like a little ball of melon. That little scooped out area would be the lacuna. And then that little ball of melon that you just scooped out, that can be like a chondrocyte. Okay, you put it back in the lacuna. Or maybe take a grape or something like that. That would be the chondrocyte. Set that down into the lacuna. Okay, so the lacuna is just that space that chondrocytes live. Guess who else has lacuna? Bone. Bone have lacunas, and that's where osteocytes live. Okay, and so next to bone, cartilage is the firmest structure in the body, and it comes in three flavors. We have hyaline cartilage, fibrocartilage, and elastic cartilage. The first one, hyaline cartilage. Hyaline means glass-like. Okay, and it's found in areas for strong support and some flexibility. You'll find it in the rib cage. Okay, your rib cage, the bones, they come from, they're attached to the spine. They come around only part of the way, and then they stop. What attaches the ribs to your breastbone or sternum is going to be hyaline cartilage. Okay? And what else? In the trachea has rings in it. Just like a vacuum cleaner hose has rings and softer material in between, so it's flexible. And what the purpose of the rings in a vacuum cleaner are for are to keep the vacuum cleaner hose from collapsing, right? Well, same thing with the trachea. Those tracheal rings keep your trachea from collapsing, but then they have more flexible material in between. Those tracheal rings are made of hyaline cartilage, and under the microscope, that's what it would look like. And it's going to form most of the skeleton before being replaced by bone in the embryo. So it forms a model, what we call a hyaline cartilage model. And then that's the template that the bones start replacing the cartilage at these primary growth plates and secondary growth plates. And again, eventually there's just a little bit of hyaline cartilage left, and that's what we find on the ends of the long bones. We call that articular cartilage. So the next time you have chicken, maybe chicken leg, chicken thigh, look on the ends of the bones. It's best to see it when it's raw, but roasted would be okay too. Fried chicken, that's going to pretty much destroy that cartilage. But if you look at chicken raw, you'll see this little white rubbery cap on the ends of the bones. That's hyaline cartilage. If you kind of play with it a little bit, you'll notice it's rubbery. That's to allow cushion in between the bones. So we have cushioning between the bones. It's also very slippery. That's so that we reduce friction between the bones. Okay? And it's kind of flexible, which, like we mentioned, is a good thing for the rib cage, since your rib cage is expanding and contracting. Now, here's the thing. When we look at this, and let's see if I can pull up my pen here. If you notice, these kind of look like eyes, don't they? Here, we'll give them a nice big smile. Okay. See how these look like eyes? And we've got them all over. So if you see a tissue that looks like it has eyeballs, then it's most likely going to be hyaline or some type of a cartilage. We call these nest cells. And here, this is my favorite. What do you think? I know what you're thinking. You're thinking, good thing you teach anatomy because you're terrible at drawing. Well, yeah, that's true. But if you draw pictures on some of these things, it'll help you remember. And that's how I remember. That's a pretty sad looking dog. But anyway, you can see here, let's make him happy. We'll stick his tongue out. There we go. Yeah, that's a pretty sad dog. But anyway, the point is these look like eyeballs. And so we know they're nest cells. And we find nest cells in cartilage. But the key point with this, and let me erase everything here and get my pointer back. The key thing with this, though, is hyaline. Like I said, hyaline means glass-like. This looks like you could ice skate on it, doesn't it? Okay, so that's how you remember hyaline cartilage. You could ice skate on it. Now, fibrocartilage, we look at this. Can we ice skate on this? No, not really. This has more cottony fibery. It does still have eyeballs. Okay, so that's how we know it's cartilage. But again, you really can't ice skate on this. It's going to be slightly compressible, but very tough. It's found in areas of the body where there's a great deal of pressure applied. For instance, this intervertebral disc. There's a lot of compression that takes place there. That's going to be made of fibrocartilage. Also in the knee. But wait a second. I thought the knee was hyaline cartilage. Well, let me show you here. The articular cartilage here is hyaline cartilage. Okay. But where you find the fibrocartilage is in the meniscus. You've probably heard of that, right? You've heard of somebody tearing their meniscus. That's the meniscus. And what happens if you tear a meniscus? Usually you tear a little flap and that flap gets caught as you're trying to extend or bend the knee. Okay, and it gets kind of locked in place. Sometimes if you kind of shake your knee around, that flap will float out of the way, and then you can bend the knee. But that's what they're talking about. This is fibrocartilage, the meniscus. And then also the jaw. You probably didn't realize that the jaw has a disc. And if we take a look, this is what we call the temporomandibular joint, or TMJ. Not TMJ syndrome, but TMJ is temporomandibular joint. We all have one of those. And if we look here, you'll see the condyle. That's the condyle right here. This is part of your skull right here, the temporal bone. Okay. There's what we call the mandibular fossa, which is kind of an indentation that this condyle fits in. But right in between there, we have this articular disc of the TMJ. That's made of fibrocartilage. Now, what happens in TMJ syndrome is sometimes the ligaments and everything can become overstretched, and the jaw hyper extends, hyper opens, and this little disc can slip out and get caught between the condyle here, your jaw, and your skull, and cause your jaw to stick open. Okay, so that would be that little articular disc of the TMJ. Again, fibrocartilage. And then elastic cartilage. This doesn't look like you could ice skate on it. Matter of fact, this one looks more like a cobblestone street. Is it all cottony and fibery? Not really. So we'll just kind of pretend like these are rubber bands. So this is our elastic cartilage. And you're going to find it like in the external ears. That's why you can bend your ear all the way down and it'll spring back up when you let go. Also the epiglottis, which is a little flap that closes up over your windpipe, basically, so that food doesn't go down the wrong way. Once food passes that and goes into your esophagus, then because that's elastic cartilage, it'll spring back up again. Okay, but that's elastic cartilage. Now, what do you think your nose is? Okay, what kind of guess would you have for the nose? Do you think it would be hyaline cartilage? Do you think it would be fibrocartilage? Or do you think it would be elastic cartilage? Okay, a lot of you out there said elastic cartilage. Actually, it's hyaline cartilage. Think about your ear. You can bend your ear over pretty flat, right? And when you let go, it springs back up. Your nose, there's some flexibility, remember, with hyaline cartilage. So you can move your nose, but if you go too far, you'll hear a little snap. Your eyes will start to water, and you're going to experience quite a bit of pain and wind up with a broken nose. And when you let go, it doesn't spring back to where it's supposed to. Okay, so that's just a little trick question that could be on a test. Bone is a hard connective tissue that consists of living cells and a mineralized matrix. And that matrix is made up of organic and inorganic compounds. When we get to bone, we'll talk about that in more detail. Also, there's two types of bone. There's what we call cancellous or spongy bone. There's also a third name for it, but again, we'll cover that when we get to the skeletal system. And then there is compact bone. Now, cancellous bone or spongy bone means that it's very porous, kind of like that coarse sponge I showed you. It's going to be more porous like that. Whereas compact bone is going to be solid. Okay, it'd be like a piece of hard plastic, basically. So here's an example of, well, this would be spongy or cancellous bone under the microscope. This would be compact bone under the microscope. So if I show you this picture, all right, and ask you to name it as far as tissues go, you would say, oh, that's bone tissue. Okay, so bone. All right. And again, all these little details here, we'll cover that when we get to the skeletal system. And I also have a model of it. And, I can make a video showing the different parts of that on the model. And then blood, the matrix between the cells, is liquid. And we have what's called hemopoietic tissue, and it's also called hematopoietic tissue as well. So again, two different names for the same thing. But this is tissue that forms blood cells, and this is going to be found in the bone marrow. And the bone marrow has yellow fat and, or I should say, yellow bone marrow and red bone marrow. The yellow bone marrow is made up mostly of fat. Now, you find that like in the shaft of the bone. If you've ever made soup, and next time you go to the grocery store, look and see if they have a soup bone. That's just a slice through the shaft of a long bone. And inside there, you're going to see the marrow, and it'll probably be yellow or white. And again, that's going to be the yellow bone marrow. That's more for energy storage. But it's the red bone marrow that's kind of shoved into that spongy bone. And that's where that hemo or hematopoietic tissue is going to be found. And that's where your red and white blood cells are made. And here's an example of bone marrow tissue. We can see the cancellous or spongy bone. Here's the hard compact bone. This is where you'll typically find red bone marrow, and this is where you'll typically find yellow bone marrow. And these are all the different immature red and white blood cells. Muscle tissue. Characteristics: it contracts or shortens with force, and it moves the entire body and pumps blood. Remember I said muscle does one of two things. It either contracts or relaxes. That's it. Okay? And again, we'll go into much more detail about this when we get to the muscular system. The types of muscle tissue that we have skeletal muscle. And typically when you think of muscles, this is what you're usually thinking of, are skeletal muscles. We say that they are striated and voluntary. Striated means when we look under the microscope, it looks like it has fine little stripes. Okay, voluntary means we have conscious control over it. We can tell it what to do. We can tell our arm to bend. We can tell our arm to straighten out, etc. So skeletal control, we have voluntary control over. Cardiac muscle, which is what makes up the heart, is striated. So it has the stripes just like skeletal muscle, but it's involuntary. We have no conscious control over it. Okay? And then smooth muscle, it's smooth because there are no little stripes. There are no striations. Okay? And it too is involuntary. So it's not under our conscious control. Like our heart, involuntary, we don't have to sit there and concentrate on, okay, beat, 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 it's going to do it on its own. Smooth muscle, the same thing. We find it in places like the digestive tract. You don't have to sit there and think about pushing stuff through your digestive tract. The smooth muscle is going to do that automatically. Okay? We find it in blood vessels. When the blood vessel constricts down, when this muscle contracts, then the blood pressure goes up. If it relaxes and the blood vessels get bigger, your blood pressure goes down. We find it in our eyes, and that's what makes your pupil smaller or larger, to let more or less light in. We even find smooth muscle attached to your hair, believe it or not. And we'll talk about that in the next chapter. So here's what skeletal muscle looks like. It's going to be multinucleated, and that's because of how it's formed. we're going to see the stripes. So you can see the stripes. And the nuclei are toward the periphery. Okay. So this would be skeletal muscle. This would be cardiac muscle. See how it looks like it's kind of teased apart with centrally located nuclei. So we can see the nuclei here. Okay. We see it looks like it's kind of teased apart. But here's how you can really tell. And it takes a little bit of practice to see these. See these little lines right here? There's one, there's one. These are pointing to them. Okay. These are called intercalated discs. So intercalated discs. If you find that, you know you have cardiac muscle. So if you're trying to tell the muscles apart and it's like, oh, that's striated, you know, that's striated. Yeah, this one looks more teased apart and it has the discs, the intercalated discs. So then you know this is cardiac muscle. The next one is smooth muscle. You see how it has these, we call them spindle-shaped or cigar-shaped or fusiform shaped. Those are all the same type of description for this type of cell, or the nucleus, I should say, that is kind of tapered. Actually, the whole cell is kind of tapered as well, like that. But anyway, you see that there's no striping. Okay. I mean, it's pretty obvious here, these stripes. Here, very obvious. In this one, we don't really see those stripes. So that's smooth muscle. Nervous tissue. It's going to be found in the brain, spinal cord, and nerves. Has the ability to produce action potentials. And the cells are going to be nerve cells or neurons. Don't call it a nerve. A nerve is something totally different. Okay, what makes up a nerve cell is we have these things called dendrites. Dendrite means tree-like formation. And here, let's see if I can show a picture. Here we go. So here's a neuron. Here are the dendrites coming off of the body. Nerve impulses, what we call an action potential, is going to go into these dendrites and then into the body, and then it's going to go down this thing called the axon. Now, why I say do not call this a nerve, because a nerve is a collection of axons. So it's a whole bunch of axons. All right. Think about it like, you ever seen these cable management tubes, you know, for like your computer and stuff? Like once I eventually get my computer set up again, I have a standing and lowering desk, and I have all kinds of corded things. Well, it gets to be a mess with all those cords, and so I have these like plastic flexible tubings that I can push all those cords into. Now, each end of the cord is loose and goes to different things. Okay? But all the main parts of the cords are all wrapped up in one bundle. That would be like the nerve. Okay? And the part that has the plug-in area, that would be like the body. And then the end that I plug into the outlet, that would be like these, what we call like a nerve ending. Okay. So again, the nerve cell or neurons consist of dendrites, cell bodies, and axons. And they can be multipolar, bipolar, or unipolar. We'll get into that at the end of the semester, what that means and what that looks like when we get to the nervous system. But not just the nerve cells are found in nervous tissue, but we also have this other stuff called neuroglia, or support cells. Okay, so neuroglia. What is glia? And I don't mean that weird TV show where all the kids are singing and the ladies mad all the time. That TV show was Glee. I don't think that's on anymore. But I'll give you a hint. Oh, yeah, that's right. I do have to stop at the hardware store to pick up some Elmer's glia. Oh, glue. Glia means glue. To the early anatomist, I think it looked like, you know, that this was gluing or cementing in the big neurons. And let's go here. So here's our neuron. See how nice and big this is? Here's a neuron. That is a baby shark. Nope, that's not a baby shark. That's another neuron. But see all these tiny little cells here? These are neuroglia. So you can see where the early anatomists would think that these are kind of gluing and holding these in place. And some of them are, okay? But some of these have other functions as well. And again, we'll get into the detail of that when we get to the nervous system. Right now, you're just looking at tissue. So if you saw a picture of this, what is this? It's nervous tissue. Now looking at membranes. The different types of membranes we have. We have mucous membranes, serous membranes, and synovial membranes. Mucous membranes line the cavities that open up to the outside of the body, and they secrete mucus. Serous membranes line cavities not open to the exterior, such as your pericardial, your pleural, and your peritoneal cavities. And synovial fluid, it lines freely movable joints like your fingers, elbows, knees and toes, okay, I don't want to start singing that song. Anyway, but those movable joints like that. And they're going to produce a fluid that's rich in what we call hyaluronic acid. That hyaluronic acid is very slippery. It's like lubrication for the joints. Okay, it reduces a lot of friction. Let's go back up to mucous and serous membranes again. The way we tell these apart is, again, mucous membranes come in contact with the external environment. So if you take your finger and you stick it in your nose, what are you touching, a mucous or serous membrane? Well, you're touching a mucous membrane. But if you take take a different finger, put it in your mouth, what are you touching, mucous or serous? It's still mucus. Okay, let's suppose you take, I don't know, a tortilla chip, get a little salsa on there, chew that up, swallow it. Finally it goes into your stomach, then your intestines. Okay, what do you think the inside of the intestines is? Mucus or serous? If you said serous, wrong. It's mucus. Because remember that corn chip came, it was found in the external environment. And so now it's touching that membrane, so it is a mucous membrane. Okay, so it goes all the way through your intestines, into your large intestine. Large intestine, is that going to be mucus or serous? The inside of the large intestine. It is still mucus. So again, anything that comes in contact with the external environment is going to be mucus. How do we see serous membranes? Well, serous membranes, we got to cut you open. Okay, so we pull out a knife, and you're like, whoa, put that knife away. That's pretty serous. Okay, so that's how you can remember that. That's pretty serous. I don't want you cutting on me now. Okay, so we'd have to cut you open to see serous membranes. We don't have to cut you open to see mucous membranes. We can just put a scope in there and look around. Okay, and looking at inflammation. Now, inflammation is a response when tissues are damaged or with an immune response. And the manifestations of inflammation, we also call these the cardinal signs of inflammation, are redness, heat, swelling, pain, and disturbance of function. Now, I don't know if you're going to have to learn these in Latin. I know I had to learn it in undergrad and graduate school. But redness is rubor, heat is calor, think of calories, right? That's a measurement of heat. Swelling is tumor. Think of a tumor, right? Tumors are swollen areas. Pain, that's dolor. And then disturbance of function is functiolatia, which um, you don't see that too much anymore in the books. But what you normally see are the redness, heat, swelling, and pain, or rubor, calor, tumor, and dolor. Okay, so what makes these manifestations happen? Well, we have these chemical mediators that are released by the cells when the cells are cut, and that includes histamine. Remember, we mentioned histamine earlier. Histamines make you leaky. Okay, so if you have more blood flow to an area, it also dilates the blood vessels as well. But if you have the capillaries are dilated, so there's more blood flow to the area, what's the appearance going to be? Red, right? So that's where the redness comes in. It's also going to be a lot warmer because of that extra blood flow, so there's going to be heat. Since the histamines also make you leaky, a lot of the fluids are going to leak out of the capillaries into the tissue and cause it to swell up. So the histamines cause the redness, the heat, and the swelling. The things like the kinins, like cystokinins, prostaglandins, leukotrienes, these are more pain mediators. So when those are released and they attach to pain nerve endings, that sends a signal to the brain saying that there is some pain. Okay? And that's why if you take like anti-inflammatories or pain medication, they tend to block like the histamines and the kinins and the prostaglandins, leukotrienes. Prostaglandins, for instance, is it PGE2s? Yeah, PGE2s are the inflammatory prostaglandin. PGE1s are anti-inflammatory. PGE2s, prostaglandin 2s, are going to be inflammatory. And we first discovered those in 1980. Okay, and guess what helps to block those? Aspirin. So even though we'd been using aspirin for, a couple of 100 years or so, actually, where you would get aspirin from is from the Salix alba plant, the white willow. Okay, it's a tree, actually. If you take the bark from the white willow and you chew on it, you'll get some of that salicylic acid. And they've been using that for about 1,000 years. Some of these branches were found in Egyptian tombs, talking about, I guess, using it for medicinal purposes. I don't know what the hieroglyphics said. Maybe chew 2 branches and call me in the morning. I don't know. But what it does is it blocks prostaglandins from being formed. And again, we've used it for all this time, never knew how it really worked until 1980 when we discovered these prostaglandins. And why are there different types of pain medications? Well, as you see here, there are different types of chemicals that cause the pain, like the kinins and the leukotrienes. And sometimes even if they act on the prostaglandins, it just operates at a different mechanism of that prostaglandin being formed. So again, these mediators are going to stimulate pain receptors and also increase blood vessel permeability. And so with tissue repair, we have substitution of viable cells for dead cells. And skin repair is going to be different depending on if we have a wound that's of primary union or a wound of secondary union. We also call this a wound of first intention or a wound of second intention. A wound of first intention or primary union, the edges of the wound are close together. So for instance, you cut yourself with a knife or with a scalpel, or even a paper cut. The edges are close together. The wound fills with blood. The clot forms. You develop a scab. You may get pus in there, especially if there's bacteria. Pus is an accumulation of the white blood cells that are trying to kill off that bacteria. Then we have what's called granulation tissue. Granulation tissue is where the fibroblasts come in and start to lay down the collagen fibers to repair that cut. And then, depending on how you heal, you may or may not develop a scar. Okay, scar is just kind of a random placement of collagen fibers. Okay, and oftentimes too, with a wound of primary intention, primary union, I should say, or first intention, if that wound does gap, it's easy to suture that together or use steri strips or whatever to put that wound back together again to allow it to heal. On the other hand, a wound of second intention, secondary union or second intention, the edges of the wound do not close. Think about, you fall and you take out a big chunk of skin. Okay. There, the clot may not close the gap. Inflammatory response is greater, and the wound contraction occurs, leading to greater scarring. And another example would be like a bed sore. Bed sore is a huge gaping wound. Okay. Well, do you think a clot is going to fill that in? No, not really. So it's basically going to have to heal from the inside out. Okay. And we'll talk more about bed sores later on. And here this just kind of shows tissue repair where you have the cut. You have a blood clot forming here to kind of stop the bleeding. Here you're going to have macrophages and fibroblasts start to invade the area. If you notice right here, this layer of the epidermis is where new skin cells are produced. Well, it's going to be hard to kind of to jump that gap right there. So that layer is going to tend to migrate downward so that it can start to close the gap and then take that blood clot that's now hardened into a scab and start pushing that up and out. Okay. Now here you can see that granulation tissue. And again, this is where the fibroblasts are proliferating. In a bed sore, you notice pinkish tissue. Okay, and that's your granulation tissue. And you can tell that it's healing. And then here the granulation tissue is being replaced with dermis. Okay. And the scab gets pushed up and falls off, and you have the freshly healed epidermis. Tissues and aging. Cells divide more slowly in older than young people, so wounds are not going to heal as quickly. Tendons and ligaments become less flexible and more fragile. I've seen more than one person that, they're getting up in their 30s or 40s and still think they can play basketball. And they go to do a jump shot. They hear or feel a snap, and they collapse down into a little heap because their Achilles tendon has become a little more fragile and calcified and just snapped. So it's also easy to kind of tear not just tendons but ligaments, so you're likely to have more sprains. So also arterial walls become less elastic, and blood pressure tends to increase. And the rate of blood cell synthesis declines in elderly, so you're going to see more anemias and less resistance to disease. And injuries are just harder to heal in elderly. Now, when I talk about these slides on aging, the one thing I want you to remember, that getting old is hell. Okay, and this just drives it home.